Hello and welcome to a new video on Silvia's Health Hints. I'm Dr. Silvia. In my previous video I gave a short introduction to the menopause, and in this video I will treat finally the hormone replacement therapy, as I know that a lot of my patients are already waiting for this video. It's not a video about the medical aspects of HRT, as I'm not a gynecologist and not a specialist in menopause. It is more a video about the common situation when a woman is already under hormonal replacement therapy and moves to Italy, or is in Italy and thinks to start with the HRT. Hormone replacement therapy is the replacement of the two hormones estrogen and progesterone to reduce menopause symptoms. Both hormones can be given separately or in combination in different dosages and forms, like tablets, patches, gel, spray, vaginal rings or cream. Some menopause specialists in some countries also prescribe testosterone. At the moment, the only evidence-based indication for testosterone replacement is HSDD, which means hyperactive sexual desire disorder. It can take some time to find the dosage and form that best fits for you. Once you feel comfortable with your therapy, it's comprehensive that you don't want to change it. The preparations can vary from country to country, so if some of my patients were forced to change the drug but didn't feel fine with the different products. If you go to Italy or to any other country for a limited period, the best solution is to take with you a sufficient supply of your therapy for the stay. If instead you move definitely to another country, like to Italy, maybe you will be forced to change your products because the drugs you used so far won't be available in Italy. And then maybe you need the help of a doctor to find the HRT preparation which are closest to your previous treatment and that fit best for you. In many countries, I know it from my patients, similar to birth control pills, HRT is prescribed by family doctors and general practitioners. In Italy, it is possible, it won't be for every doctor, but it is possible that a GP won't be able to cope with this, because he said, it's not my field, I don't know how to do it. Especially if you want to start a hormone replacement therapy, it is best to go to a gynecologist who is specialized in menopause and hormonal replacement therapy. Testosterone at the moment cannot be prescribed to women in menopause in Italy. This is also something to know. I had patients who already started a replacement therapy of testosterone, and then it was very difficult to cope with the situation when they ran out of their medicine. This is about hormone replacement therapy. I thank you for watching this video, and we see each other next week.